Good morning, everyone. We are going to talk about Section A, Administrative Information Updates. The updates in this section include program interruption, item removal, and the Social Security number removal initiative. On this slide and the next one, we have a list of acronyms that will be used throughout this presentation. You can also find this list of acronyms in your participation folder for your reference. In this presentation today, we will define Section A, and I will explain its intent. I will share with you the new items and changes for the LTCH CARE setting in the dataset version 3 and 4. I will also discuss the coding instructions for these items. At the end of this presentation, you should be able to identify the items being removed from Section A and explain how the Social Security Removal Initiative transition impacts the data collection on the LTCH CARE Data Set. Overall, Section A is intended to capture key information that uniquely identifies each patient, such as the LTCH in which he or she receives health care services and the reasons for the assessment. We will begin a detailed review of Section A with the changes between LTCH Dataset version 3 and version 4. The following program interruption items have been removed from the Data Care Set version 4. A 2500, this was the yes/no section question, including if the patient had program interruptions. A 2510, which was the number of program interruptions during the stay. In A 2525, this was the start and end dates of the interruptions up to 5. I know you all appreciate these removals as much as we do in our facility. No changes have been made to this item set. However, changes to policy dictate changes in the coding instructions for this item. We are now going to walk through each data element in Section A and provide coding guidance. Remember, the intent of Section A is to gather identifying information about the patient and facility they are at. The first element in Section A, 0050, asks us to code what type of record we are entering and to indicate if the assessment is a new assessment, a modification to an existing record that we have previously submitted, or an inactivation of an existing assessment record. There are no changes to Section A0050. Section A0050 would only be used to modify an existing record if the LTCH CARE data set was already submitted to KEYS ASAP system with inaccurate information. Modifications cannot be made to the assessment reference date, admission date, discharge date, or any other patient identifiers in Section A. If we are requesting an inactivation of the record, we would have all the information from the original submission as part of the inactivation request. All values must match the original submission. Inactivation requests are used when the event did not occur. For example, if a planned discharge assessment was submitted and the patient was not truly discharged. Here is where we provide the identifying information for the LTCH. The LTCH needs the NPI and CCN numbers as well as the state Medicaid provider number when known. There are no changes to Section A0100 facility provider numbers. The next section is A0200. Type of provider in this section is quite simple, as there is only item for selection, that is long-term care hospital. LTCH and long-term acute care hospital are the same type of hospital. Medicare uses long-term care hospitals in the abbreviations such as LTCH. We are characterized by our certification as acute care hospitals with patients requiring extended hospital level of care following a short acute hospital stay. There are no changes to this section. There are no changes to section A0210. The assessment reference date is captured in A0210. I think I'm one slide ahead. This is the end of the assessment period and can be no greater than 3 calendar days of the patient's stay. Any assessment outside the assessment reference date are not to be included in the LTCH CARE Data Set. For example, if you had a patient who was weighed on day 4 of their admission, that assessment cannot be documented. The assessment reference date is the discharge date for planned and unplanned discharge assessments. If the patient expired, the assessment reference date is the date of death. Again, no changes to A2010. This is how it appears on the CARE data set. All boxes in the date need to be completed. The admission date is documented in A0220. This date is used to match KEYS ASAP records. When entering this information, you need the most recent date of admission to the LTCH, and there are no changes in this section. Planned discharge with a change in discharge date should be coded as planned discharge and is not considered an unplanned discharge. The facility should complete the unplanned discharge assessment to the best of its abilities. If you are unable to answer a particular item on the LTCH CARE data set due to inability to assess, you would code the item with the default response as a dash. CMS expects dash use for quality items to be a rare occurrence. Use of dashes for items necessary to calculate quality measures may result in a 2% reduction to the LTCH APU. There are no changes to section A0250. For unplanned discharges, an unplanned discharge is when a patient has an unplanned transfer to another hospital or facility that results in the patient's absence from the LTCH for longer than 3 calendar days, including the date of transfer. An example of this absence would be the patient was transferred to an emergency department of another hospital to either stabilize the condition or determine if an acute care admission is required based on emergency department evaluation. This transfer may result in the patient's absence from the LTCH for longer than 3 days. In these cases, you may have assessment information that is not available. If you are unable to answer a particular item on the LTCH CARE data set due to inability to access, you would code the item with the default response of a dash. Again, CMS expects dash use for quality items to be rare occurrences, so you want to use them sparingly and only when appropriate. If the patient is transferred out and returns on day 2, this would be a program interruption, and therefore no assessment on the CARE tool set is required. Planned discharge, it's important to point out that a planned discharge with a change in discharge date should be coded as a planned discharge and not considered an unplanned discharge. For example, if a patient was originally scheduled to be discharged on 5/1 and it is delayed till 5/2, you would use the actual discharge date of 5/2 even though it deviated from the original plan. It was still a planned event. There are also no changes to Section 0270, which is where we document our patient's discharge date. Section A0500, legal name of the patient, is another section used for matching data in the KEYS ASAP and is also unchanged. A few important tips for this section. You must use the patient's legal name, no nicknames or shortened names. You can leave A0500B blank if the patient has no middle name. If the patient has more than one middle name, use the initial of the first middle name. In the event that a valued method for checking a patient name is not available, you may ask family members, significant others, guardians, or legal authorized representatives for this information. For Section A0600, Social Security and Medicare numbers, I mentioned that the item on the CARE data set has not changed, but the coding instructions have changed. You can see that the fields in this section for completion remain straightforward and request the Social Security number and Medicare number. If the patient does not have a Social Security number, the item may be left blank. The health care insurance claim number may differ from the patient's Social Security number. For example, many patients receive Medicare benefits based on a spouse's Medicare eligibility. As most of you are aware, to deter identity theft, CMS is replacing the Social Security number-based health insurance claim number with a new identifier, Medicare Beneficiary Identifier. The HICN may differ from the patient's Social Security number. The changes to coding for Section A600 are listed here. This transition impacts how we will submit the data in A0600. If the patient does not have a Social Security number, the item may be left blank. If you have a patient assessment prior to April 1st, 2018, you enter the health insurance claim number. If you have a patient assessment that is being completed between April 1st, 2018 and December 31st, 2019, you will enter the patient's Social Security-based health insurance claim number or the patient's new Medicare beneficiary identifier. If you are completing a patient assessment after December 31st, 2019, you will exclusively use the Medicare beneficiary identifier. There should be no use of the Social Security-based health insurance claim number beyond December 31st, 2019. Section A0700 is unchanged. Here is where you enter any Medicaid numbers. If you are notified later that a patient does have a Medicaid number, just include it on the next assessment. Section A0800 is unchanged and is another section used for matching identifiers with KEYS and ASAP. Either male or female must be entered in this section. Section A0900, birth date, is another matching element for KEYS ASAP, and there are no changes to this section. Fill in the first box with a 0 if the month or day contains only a single digit when filling out the patient's birth date. For example, if the patient's birth date is in January, you would fill in the box labeled month with 01. If the whole birth date is unknown, fill in what is known and leave the unknown portion blank. For example, if you only know the patient was born in May 1956, you would fill in 05-1956. Section A1000 has no changes. The race, ethnicity codes used the common uniform language approved by the Office of Management and Budget to report racial and ethnic categories. The categories in this classification are social political constructs and should not be interpreted as being scientific or anthropological in nature. Ask the patient to select the category or categories that most closely correspond to his or her race, ethnicity from the list item in A1000. If the patient is unable to respond, ask a family member, significant other, or guardian, or legal authorized representative to give you the information to fill out the section. Provide category definitions to the patient, family, significant other, guardian, or legal authorized representative only if they request them. Offer the option of selecting one or more racial designations. Observer identification or medical record documentation to code this item can only be used if the patient is unable to respond and/or no family member, significant other, or legal authorized representatives are available. Language barriers can interfere with accurate assessment of patients' condition, treatment planning, and healthcare deliveries. This section requires preferred language and identifies patients who need interpretive services to communicate with healthcare staff, participate in care decisions, or participate in and understand the constant process. This section has not been changed. Again, no changes to this item. Section 1200, marital status, is an unchanged section. Identifying formal relationships of a patient is important for discharge planning. The categories for this item are designed to be mutually exclusive. In other words, we don't want a person in one group to also be categorized in another group. Please choose the answer that best describes the current marital status of the patient for this item. For example, if a patient has never been married and is currently single, you would code 1, never married. Alternatively, if a patient was divorced and currently single, you would code 5, divorced. Similar to other sections we've discussed, a family member, guardian, significant other, or authorized representative can be consulted in their absence if the patient is unable to communicate. For Section A 1400, payer information, here you would check all that applied. Knowing where the patient's previous setting prior to admission was helps to inform the delivery of services and may also help with discharge planning. Section A 1802, admitted from, asks the LTCH to document the patient's setting immediately preceding the current admission. A 2-digit corresponding code will be entered. There are no changes to this section. A2110 is the discharge location and should be documented on the planned discharge and unplanned discharge assessments. This section is also unchanged. Time for a knowledge check. Grab your phones and join the knowledge check section. After which date should you enter the patient's new MBI for A0600 and not report the patient's Social Security-based HICN number? A, April 1st, 2018, B, July 1st, 2018, C, December 31st, 2019, or D, December 31st, 2020. It looks like 83% say C, December 31st, 2019. That is the correct answer. Next knowledge check question. Mrs. G's discharge date was rescheduled from September 22nd to September 26th. Which type of discharge assessment should be submitted for Miss G? A, an unplanned discharge assessment, B, planned discharge assessment, C, both A and B are correct, or D, none of the above? Ooh, looks like 100% of you are saying B. Let's see if that's correct. The correct answer is B, planned discharge assessment. Knowledge check number 3. Which Section A item has not changed in LTCH CARE Data Set version 4? A, discharge location, B, Social Security and Medicare numbers, C, program interruptions, or D, program interruption dates. 86% are saying A, discharge location. Let's check that answer. The correct answer is A, discharge location. Moving on to Section A2500, A2510, A2525, program interruptions. We can all celebrate the removal of these elements from the LTCH CARE Data Set version 4. All of the definitions and guidelines associated with LTCH QRP and program interruptions still apply. For example, the difference between a program interruption and a discharge and subsequent discharge assessment being needed if the patient remains outside of the LTCH for greater than 3 days. An example of program interruption would be when the patient requires a higher level of care and is transferred to an acute care hospital. Remember that day 1 begins on the day of the transfer, no matter what time the transfer occurs. When a patient has a program interruption, a discharge assessment is not required for submission. Knowledge check 4. Due to the removal of program interruption items from Section A, the definition and guidelines for the program interruptions no longer apply. True or false? Well, 89, 92% answered false. The correct answer is false. LTCH QRP definition and guideline programs for program interruptions still apply. So in summary, what we've reviewed today for Section A is that it's largely unchanged with the exception of the celebrated removal of program interruptions in Section A2500, A2510, and A2525. And the revisions to the coding instructions for A0600 to concede in the Social Security number removal initiative. With this information, you should all return back to your facilities and work with your teams to review Section A in its entirety, the rationale and the steps for assessment. Make sure everyone is aware of the transition timeframes for the health insurance claim number to Medicare beneficiary identifiers. Review the program interruption definitions despite the items having been removed from the assessment, as they still have implication in our determinations. This concludes Section A, Administrative Information Updates.